I was diagnosed with ovarian cancer in May of 2011 and was operated on in Boston. It was stage 3, and I received treatment, chemotherapy at Landmark Medical Center in Woonsocket.
I went to the hospital because I thought I had pneumonia. And they did a chest x-ray. And then they came back and said they wanted to do a CAT scan. So they did the CAT scan, and this doctor came back in the room and she said, "There's a spot on your lung and we think it's cancer." It was small cell lung cancer. And the problem with it was that it grows very rapidly. But the good news was I didn't need surgery. So I went to chemo 3 days, once every 3 weeks. And I went to radiation every day for 6 months. And today it's almost 2 years, and I'm still cancer-free.
When I was 5 years old, I was diagnosed with neuroblastoma. It wasn't the first time my family heard the words, "Your child has cancer." My younger brother, Michael, passed away a year before from brain cancer. So going into it for a second time with my parents, they knew that they wanted to choose a method that was going to be healthy for me, for a healthy lifestyle in the future. So we chose to do a natural regimen, to go into the surgery, do the treatment as natural herbs and different things going on. It was completely new. Many doctors doubted it, but it came out helping me in being able to be who I am today and live a healthy, fulfilling lifestyle.
I have multiple diagnoses. So the first time was in 1997. I was 25 and just sort of really starting to embark on life. And I was diagnosed with CML, chronic myelogenous leukemia. At that time, I was told that without a bone marrow transplant, my survival would probably only be about 3 years. So there really wasn't a whole lot of consideration for me at that time. Being 25, I figured it was a no-brainer. I have to go for the transplant. The recovery from transplant is sort of a long and arduous process. I was out of commission, if you will, for about 1.5 years, and then started to engage back into life. And just as I was getting ready to enter grad school in 2005, I was diagnosed with cancer once again, kidney cancer, stage 1. And that was a little bit easier process in treatment. It was surgery and nothing else. But mentally, I think that affected me a great deal more than the leukemia did in '97.
I would just say that knowing what to expect, both hospitals and physicians and nurses were wonderful. I guess what kind of side effects to expect after surgery and chemotherapy.
I would say transportation. Because if you don't have a car and you have to go to treatment every day, it puts a strain on your family.
I know communication was one of the biggest things my parents still stress to today, and having a support system there, which now Hasbro has many cohesive groups to support the parents.
Oftentimes, we don't know how to address the psychosocial aspects of care. We treat it all as a sort of medical component. But in today's medicine, you present to me in a certain way with a certain stage cancer and you're at a certain age, all I have to do is type that information into a computer and it spits out options on how to treat you. But you're a very individual person with your individual lifestyle and your individual family and job and all these things, and all those are components and factors into your care as well. And so that's where that individual aspect and getting the patient involved in that care. And so as medical professionals, we've always taught people, we know what's best. We're going to tell you instead of involving the patient, say, well, what is best for you? Because what is best for you may be different than what is best for someone else.
Probably more support from cancer survivors. People that have been through it and came out fine on the other end.
I think the patient advocacy is really important, and I think every hospital should have a patient advocate to help walk the patient through different phases of their treatment.
A lot more collaboration like this, because it tends to be in the medical system that, we all want to take ownership to what we do, and we want to take ownership to our patients, instead of sharing information, sharing and collaborating together. So, I think it's been said a few times here today is that, getting people together and at the table and sharing information, this is a big thing in order to do, because we're talking about doing this as a result, that we want to make sure that all the different components of someone's care are sharing information and that the patient actually has access, and not only access, but understands the information. We talk in medical terms, and survivors and patients and caregivers don't understand what all those medical terms are. So I believe in just continuing connecting the pieces together. And there's a big focus today on primary care and getting primary care physicians sort of more informed about all the different aspects of cancer care.
Working with the patients and the doctors, and all the doctors, when you go in for cancer, you're not just working with the oncologist, you're working with your primary, you're working with the anesthesiologist, you're working with everyone all the time, and you're having so many different voices. You need to be able to all come together, all collaborate, and talk about what's actually happening, so the patient's not going with 5,000 different opinions, because when that happens, confusion goes on, and then they are scared. This is something major happening, their family's concerned. So if we all just work together and collaborate away, so everyone, the primaries, the physicians, down to the anesthesiologists and the nurses, all work together.